First and foremost, we open up the dialogue with the patient and caregiver. There is always uh, communication, very good communication established with the patient. Like one of our patient, old man with cancer of the tongue, he had a huge growth in the tongue. He was not able to speak. So you can imagine that how aggressive he was, and whole throughout his life he was very dominant person, taking all the decisions in the family, and now he is not able to speak. He was so aggressive that he used to beat his wife, used to show tantrum to his, he will not take medicine and all such things. We tried to explore, then luckily he was able to write. Otherwise, many of our patients are illiterate, then it's very difficult to communicate with them. So he expressed one day that I want to play tabla. We inquired from the family why he wants to play tabla. He was a mill worker. He said, no, it was his hobby to play tabla every day evening. He used to gather people around and play tabla at night. So we got him tabla. Then he said, I want to paint this tabla in my own way. We got him paints also. Next day onward, he started playing tabla. Every day evening, he will gather all other patients surrounding in the hospice, other beds, and he used to play tabla for 1 hour, half an hour or so, whatever. And that brought so much of peace with himself. So this is the way we explore the patient's requirement, patient's previous history. One of the patient similarly aggressive. We came to know that he was very kind person. He used to serve people. Seva karta tha logo ki ja ja ke. He used to take children to school. He used to give money for their books and all such thing. And now he's almost all dependent. So we explore their past. We call this dignity therapy also. That whatever good, every person has done something good in life. We tell them to narrate that. We talk about it. We convey this story to their children, their caregiver. No, so bring up their good quality of life they had already spent and talk about such things. And that is how we address the psychosocial issues.